conflicting, and often sensational information, it's become difficult to discern what constitutes a healthy habit and what might be harmful. Could daily ejaculation be a sign of a robust libido? Or is it just a case of too much of a good thing? What does the scientific consensus say about this personal practice? Today, we will confront this topic directly. We will provide a thorough examination based on scientific facts surrounding daily ejaculation. Why can't we simply say yes or no? Because reality is far more complex and nuanced. Instead of a simplistic verdict, we'll explore both the potential benefits identified by research and the possible issues you should be aware of. By the end of this video, you'll have a much clearer and better informed understanding of how this common habit can influence both your physical and mental health. Let's start with the scientifically supported benefits. Benefit 1. Triggers the production of happiness hormones. What is the first scientifically backed benefit of ejaculating daily? It stimulates the production of a powerful set of pleasure-inducing hormones. When you reach climax, your brain orchestrates the release of a potent cocktail of neurochemicals. So, what exactly are these chemicals? They include endorphins, your body's natural painkillers that also act as strong mood elevators. You also get a significant surge of dopamine, a neurotransmitter crucially linked to feelings of pleasure, motivation, and reward. Then the brain releases oxytocin, often called the love hormone, for its role in promoting bonding and deep relaxation. Finally, serotonin, a key mood regulator, contributes to your overall sense of well-being and happiness. Why is this hormonal release so beneficial? This cascade is why you often feel relaxed, happy, and deeply satisfied after an orgasm. Regular release of these hormones can contribute to an improved overall mood, reduce your baseline stress levels, and provide a powerful natural antidote against daily anxieties. Benefit 2. Promotes deeper, more restorative sleep. A notable improvement in sleep quality. If you've ever felt sleepy or drowsy shortly after ejaculating, you're not alone. This is a very common physiological response. So, what causes this feeling? It's largely due to the release of a specific hormone called prolactin. Prolactin is a chemical messenger known to induce deep relaxation and sleepiness. That's why countless men report finding it easier to fall asleep after sex or masturbation. But is that the only factor? The pleasure hormones we just mentioned, like oxytocin and endorphins, also work together to significantly reduce stress and promote a state of deep calm, making it much easier for your body and mind to transition into sleep. So for someone struggling with insomnia, restless nights, or difficulty relaxing, what does this mean? This natural sedative effect can be a major benefit, potentially leading to better sleep quality, and as a direct result, more sustained energy and mental clarity throughout the day. Benefit 3. Encourages vasodilation and improves circulation. What is the third benefit daily ejaculation might offer? It promotes vasodilation, the biological term for the widening of your blood vessels. How does this work? During sexual arousal and orgasm, your heart rate naturally increases, and blood flow improves throughout your body, not just to your genitals. What effect does this have on your system? This process helps your blood vessels expand and become more flexible, which is deeply beneficial for your entire cardiovascular system. What is the long-term impact of better circulation? Improved blood flow ensures oxygen and essential nutrients are delivered more efficiently to all your organs and tissues. Over time, this can contribute to better heart health and even help lower your blood pressure. Think of it not as intense exercise, but as a gentle and consistent workout for your circulatory system. Benefit 4. associated with a lower risk of prostate cancer. One of the most discussed benefits of regular ejaculation is its potential to reduce your risk of prostate cancer. Several major studies have meticulously examined this relationship. What does the research say? The most notable is a long-term study by Harvard University that followed over 30,000 men for nearly 2 decades. The results published in the prestigious journal or European Urology revealed a compelling finding. Men who ejaculated frequently, specifically 21 or more times per month, had a significantly lower risk of developing prostate cancer compared to those who ejaculated less often. What is the leading scientific theory behind this? The prevailing theory is that frequent ejaculation helps flush the prostate, removing potentially harmful substances and old cells that might otherwise accumulate and eventually become cancerous. While this isn't a definitive guarantee or prevention method for everyone, it offers strong evidence that regular ejaculation can play a powerful protective role for the prostate gland. Benefit 5 might boost your immune system. What is the fifth and perhaps unexpected benefit? A possible boost to your immune system. You might not instinctively associate ejaculation with fighting off colds, but some emerging research suggests there could be a link. What does science indicate? Studies have shown that sexual arousal and orgasm can lead to increased levels of antibody proteins, like immunoglobulin Ig. Why is Ig important? Ig is recognized as one of your body's first lines of defense against invading viruses and bacteria. But is that the only connection? The stress-reducing effects of orgasm also play a crucial role. Chronic stress is well known to suppress the immune system, making you more susceptible to illness by helping lower your baseline stress levels. What can regular ejaculation do? It can indirectly support a stronger, more responsive immune system, which in turn helps you stay healthier overall. Potential problems or downsides. Problemone can become a psychological compulsion. What is the first potential problem that can arise from this habit? The risk of it becoming a psychological compulsion. It's absolutely crucial to make a clear distinction between a healthy, pleasurable habit and compulsive behavior. How can you tell the difference? If you genuinely enjoy ejaculating daily, and it doesn't negatively affect any part of your life, it's very likely not a problem for you. But what if that changes? If you start feeling an overwhelming, uncontrollable need to do it every day, and it begins to interfere with your work, social life, or responsibilities, it may be a sign it's shifting toward compulsion. What characterizes compulsive behavior? Compulsive behavior is defined by a total loss of control, where the act is no longer a conscious choice, but a perceived necessity. What are the consequences? This can lead to deep feelings of guilt or shame and may indicate an underlying psychological issue that needs addressing. Problem 2 can affect fertility. The second potential problem is specifically related to fertility, a decrease in sperm count per ejaculation. Why does this happen? Your body requires a certain amount of time, generally about 72 hours, to produce and mature sperm to peak levels. When you ejaculate every day, your body simply doesn't have enough time to fully replenish sperm reserves to maximum concentration. What is the outcome? This results in a lower total sperm count per ejaculation. For most men, this wouldn't cause concern. But in a specific scenario, where you and your partner are actively trying to conceive, what is the consequence? Daily ejaculation could reduce your overall chances of success. What is the solution here? Spacing ejaculations every 2 to 3 days can help ensure a higher sperm concentration, potentially increasing fertilization likelihood. Problem 3 can contribute to premature ejaculation and erectile dysfunction. What is the third and final potential problem? the possibility it could contribute to premature ejaculation and erectile dysfunction. How does this happen? This is especially true if daily ejaculation occurs through quick masturbation. If you get used to rushing to reach the finish line as fast as possible, essentially you're training your body and brain for a sprint, not a marathon. This conditioning can be difficult to unlearn and often translates to premature ejaculation during partnered sex. But is that all? Number. It can also create a destructive cycle of performance anxiety. What is the consequence of performance anxiety? Worrying about lasting longer can in some cases contribute to psychological erectile dysfunction, where the fear of underperforming makes it hard to get or maintain an erection. I know for many men hearing about problems like premature ejaculation and erectile dysfunction can be incredibly frustrating and even shame-inducing. These are common struggles, and seeking real lasting solutions can feel overwhelming. While our primary focus today is understanding the science behind daily habits, I wanted to share something I found for those of you who might be looking for a powerful next step. It's a fascinating video revealing a very different approach to restoring male performance. What does it detail? A surprisingly simple 7-second home remedy that is 100% natural and designed to reverse what new science suggests is a root cause of these performance problems, all without pills or injections. Why is this so revealing? It's one of the most honest science-based presentations